Today is Monday, April 20th, and this is Career Week 2015. Today's guest presenter is Tonya Eckstein discussing nursing careers.
Hi, my name is Tonya Eckstein. The title of this will be A Day in the Life of an ER Nurse and Other Opportunities. So definitely it is one thing that you will always have a job doing. So if you're bored with one thing, you can certainly move on. A little bit about my career history. From 1991 to 1994, I started working 2 days after I graduated from San Juan College. In 1991, I started on the medical floor at San Juan Regional. I worked there for about 2 years until I had my first child, and I thought there was no possible way I could possibly be a mother and work 12-hour shifts. So I went to home health care, where they had nice, sweet 8-hour shifts. And what I soon realized is that I could be a mom and work 12-hour shifts, because that definitely was not for me. I liked it, but I just found that I was the type of personality that I needed to be able to finish my job and go home at the end of the day, because I never seemed to be finished at home health care. And I would be up till like 2 o'clock in the morning doing papers and that I didn't do during the day while I was at work. And if you'll notice the time frame right around there, they kind of coincide. When I found out that that wasn't for me, luckily I had stayed on call on the medical floor, and I went back to the medical floor and then went on call for home health care. And then in 1994 I went to the PRT, which is the Professional Resource Team, better known as the float pool at San Juan Regional. And that department goes everywhere in the hospital except the actual labor and delivering babies. They don't go into the OR, and they don't go into the cardiac cath lab. I don't believe they go into the behavioral health setting anymore. When I worked in the float pool, I did work in the behavioral health wing, which I soon found out that also was not for me. Right toward the end of my career. So what you did when you did the float pool is you had a set schedule. Every morning you would call, and they would tell you where you were going that day. So if they had sick calls on surgical floor, you went to surgical floor. If there were a bunch of babies being born, you'd go to OB that day. And I found that one morning I was saying, I was dialing the phone and saying, please ER or ICU, please ER or ICU. And my husband said, why don't you just go work in the ER or the ICU? So I had really fallen in love with both of those places, and there was other nurses in the float pool that couldn't stand going to the ER because it was just kind of a stressful place to be. So when they got assigned the ER, we would trade. So I went to the ER a lot and decided in 1999 to go to the ER. Worked there until 2002 when I transferred to air care. And I worked air care until 2010, and that was absolutely the best job I ever had. Who would think that you would get paid to fly around in helicopters and go fun places and see scenery and get to do the things you do? And that was probably the highlight of my career. But right around 2009, my youngest son, by now I've had 3 kids, and my youngest son is 12, and he's freaked out with me dying, and he's calling me all the time saying, I got a bad feeling, don't fly. So I figured if I wasn't going to give my 12-year-old an ulcer, it was just a job and I should do something different. So I went back to the ER in 2010, and I'm still there. So why the ER? Why would most people that are in the ER, I can tell you that nobody that was working with me in 1999 in the ER is still there. And I kind of considered myself always in the ER, because when I was on the flight team, if you weren't flying and actively doing air care duties, you were in the ER working, helping, because it's such a busy place. So I kind of always consider that I've been in the ER in one form or another since 1999. And there's not anybody that's still in the ER. So since I started there in 1999. There's a couple of doctors that are saying, actually there's one doctor that's the same. So it's just a hard place to work, but the stimulation and the adrenaline, I guess, and the fact that I'm never bored, it's never the same. You can go to work and really make a difference. Some days you go home and you don't feel like you made a difference at all, and I definitely have nights where I go home and think, what the heck am I doing still in this environment? And then the very next day, some cute little Alzheimer's patient will come in and I will be assigned to him, and you know, knowing that I can make a difference. And my dad passed away with Alzheimer's, and I think that my whole training up until then was God saying, you've got to prepare for this, because that's definitely the hardest thing in my life I've ever done, is try to work and be a wife and be a mom and take care of my dad. And I think those are probably one of my favorite people to take care of that come in, because I do understand and I realize that it's the family that really needs the support. My dad could have cared less that he had Alzheimer's. He even in his own little happy place. It's the families that really need your support. So definitely going home at night and knowing that somebody just needed you to be strong for them, you can make a difference. Probably the most, I guess the biggest reason when I say you cannot make this stuff up, the stuff that you see in the ER, there are some just crazy things that happen out there, and you just sometimes go home shaking your head. And you can go home and try to tell your family how your day went, and I really don't talk about work too much, because it's just an environment that really, unless you're in it, nobody really understands. So my son's fiance works in the ER with me, so when they come over, we're always talking about work and we're exchanging our stories, and my son and my husband go, why are you guys always talking about work? I guess because we get each other and nobody else really gets. You definitely have a close bond and teamwork. Working on all the floors. It's not that there's not teamwork on the floors, but you can't see the stuff we see and go through the stuff we go through and not form a close band with each other amongst coworkers. And you're there for 12 hours. You're almost at work more than you're home sometimes, so you better like the people you work with and play nice together and get along together. And truly, the people that I work with are my best friends, and the sense of knowing what you're going to do. We can go in a room with a critical patient, nobody really even has to talk. One person just starts an IV, the other one's doing an EKG, and you just kind of mold and do what you need to do to make it work. So these are some funny rules, some funny pictures. Back in the day, we used to have a lot more fun than we have now. It's not that it's not fun. No matter what, we always have fun, even if it's busy. Every Halloween for as long back as I remember, except for the last 3 or 4 years, we always picked a theme. And registration, the air care crew, all of us dressed up as something. And the one in the convict suit, we all dressed up that way. We see all kinds of people from the jail, and we get all kinds of people that the police bring in for this and that. And not one person that night, we were so disappointed, came in from the jail, because we were sporting our homemade tats and teardrops, and nobody came in, but we still had fun. And we did the Pirates one year, and we're not allowed to do that anymore. So we struggled with that. So after the rules, we still have fun. So we dressed up as nurses and bought white hoses and little dresses, and we all would have had nursing hats if the dress code policy had not forbid that. So, and that was kind of neat, and the patients kind of laughed. And when I started at the hospital, we had to wear the white pants and the white shoes and stuff like that. So that's evolved over the year. So definitely, in any job you have to have fun. I think it's the only thing definitely in the ER that keeps me sane, is just the fact that it's a lot to go through if you can't smile and laugh about stuff that happens, and the whole you can't make this stuff up, because it definitely is that way. There's definitely a sense of family and community with those of us who work in the ER. We all had, this is the first year, I'm sure most of you know the Get Pinked campaign, and we were big in that the first year that it started, mainly because one of our paramedics that works for EMS, her mom is Kathy Lincoln, and the Kathy Lincoln Memorial Fund is what the Get Pink campaign for breast cancer funds. And also one of our nurses at the time was just diagnosed with stage 4 breast cancer. So we had a fundraiser. We all bought these pink scrub tops and we sold them, and throughout the hospital it was kind of neat because the other floors bought them too, and we wore them on Tuesdays and Fridays. If you worked on a Tuesday or a Friday, you wore your pink scrub top, and it kind of brought everybody together. And we were doing the pink glove dance the first year they had that. If you haven't ever taken part or seen one of those, they're kind of fun. Definitely we do some crazy things to support each other. In the middle is Nicole. She's one of our clinical coordinators, and she was diagnosed with leukemia, and we were doing a CrossFit, I don't know, fundraiser. I can tell you it was painful because I'm not into that stuff, and our team was actually called the Slufful, what was it? I can't remember, but
Sluffalopicus?
no, it wasn't Sluffalopicus. If I could see my t-shirt there, I would tell you, but we did I'm not an exerciser, so that was more than my body was, it was pretty painful. So anyways, the Slothful Slugs, that's what we were. So I put an email out, I need a team, but I don't want any of those competitive type people, because we're just doing this for a fundraiser and to have fun. And it was pretty humorous. This was a Christmas party. We do a lot of stuff out of work. And again, you kind of have to, it's our own way of debriefing, I guess. And doing stuff away from work, because we do get very close, and we kind of sometimes know more about, about everybody's family and their kids, and we've all grown up together, and they hear me every morning trying to call and wake up my son, and you kind of grow up with these people, and their kids grow up with each other. So unfortunately it can't all be fun, and there's a reason that we see the things we see and we bond and get so close. So the typical part of an ER day is that nothing is ever typical. We start the day, you've seen a few coughs, colds, abdominal pains, some broken bones, and we're kind of easing into our day, being silly, taking care of our patients, and you hear a big loud knock on the back ambulance bay door, and everybody kind of, you never know what's coming next. And then you look out to find something like this, and surprise, you got some gunshot victims, and you would think that, why would you see that? Well, I can tell you that they don't call the ambulance most of the time, because usually gunshot stuff a lot of times is gang related, and their buddies are nice enough to scoop them up in a car and speed up and throw them out, knock on the door and run, because they don't want to be involved, because somehow they probably were involved. And so that over the years that I've worked in the ER, I've probably been there for 4 or 5 of these surprise backdoor knocks. It's not always a gunshot, sometimes it's a stabbing. It's always a bad thing when the back door frantically knocks. And then all of a sudden your life just changes. Everything changes speeds. Usually when I work, I'm in charge. So you've got like 50,000 things going on in your head. The first thing you always have to think of is, where is the shooter? Is it gang related? We call a lockdown, which is a code gray. So you call the operator and do a code gray, and that actually locks all of the doors in the hospital, because usually whoever shot these people will want to finish them off, and we don't let anybody in or out until we've got everything under control. We got to call the police. We call a level 1 trauma ×2 or a level 2 trauma, depending on their injuries. And when I left work just a while ago, we didn't have one open room in the place, and we had people stacked in hall beds. So at any given time, I have a hard time finding a room in the ER. So when something like this happens, you're literally just dragging stable patients out of their rooms, putting them in the hall, and you've got to move around staff because somebody that's this sick and in this much trouble, depending on where their gunshots are going to take a couple of nurses per gunshot victim. So there's just a lot of scrambling. Call administration's way down there. We're supposed to call administration prior to any lockdowns because it's a big deal and it kind of shuts the whole hospital down, but I always just call the code gray first because I'm not going to call and get permission to lock down because I don't know where the shooter's at. And they're usually fine with that. It's just something that we're supposed to do up there, but it doesn't usually happen. You kind of just get in your mode and start doing what you need to do. There's a lot of things to think of all at once. Chaos ensues. You're trying to, who are these people? The media will start calling and trying to get information from you, and and they'll try to say, no, it's my son, or, it's pretty amazing the links that they'll go to try to get information. Security will be looking at, the cameras at the doors to see if they can get a license plate, get anything. And of course we're trying to save their lives. We're doing all this other stuff, but we are trying to save their lives. And of course no one's talking. No one, if they're awake and alert, I can't count the times that I was just walking down the street and somebody shot me. They didn't see the car, they didn't see anything. So other exciting things happen too that keep us there. We deliver babies. They come really quick sometimes and you don't have time to get up to the OB floor. So we've definitely delivered a lot of babies. I would take a gunshot wound any day over a baby because that just scares me. I did work with the ambulance for a while, and when I worked with air care, that was my biggest fear, and it never happened while I was alone. It's not so bad in the ER because you got a doctor there and you got a lot of people, but when it's just you and your partner in a helicopter or in the back of an ambulance, and those things are slippery. And so much can go wrong. So that definitely happens a lot, that people come to our front door, especially at night, even though OB's on the complete other side of the hospital. We've delivered them in the parking lot, in the hallway, all kinds of crazy places. Another thing, like here in our small community, there's no such thing as divert. If you're in Albuquerque and your ER's full, they'll go on divert, and they'll tell the ambulance, we're full, we don't have any beds in this hospital. The whole hospital's full. Well, we don't have that. We're it. So other than Durango, that's the closest hospital. I mean, and then there's Shiprock also, but as far as Red Mesa, Arizona, any of those outer line clinics, Northern Navajo doesn't have cardiology, they don't have neuro, they don't have it's not a trauma center. So anybody that's got a bad injury is going to end up coming here, and you can't turn them away. It's so that they're coming. So we just have to figure out how to deal with it. Another big thing that is very fast and very quick, a STEMI alert. A STEMI stands for a ST elevation MI, and not that you're all that interested in it, but this is a normal heart wave, and they call this the PQRST. Not that you're interested in that, but if you've had a big, nasty, ugly, what they call a STEMI, which is a ST elevation, so right in here, you can just tell. I won't pretend like I'm all good at cardiac stuff, but I can take one look at this and say, we need to do something quick or this person's gonna die. So the ambulance, and what that is if your arteries are blocked with plaque or anything like that, and this is when that happens, and blood and oxygen are not getting to a certain area of your heart, and for as long as your heart's not getting blood and oxygen, it's dying. So when we have these, anybody that walks through the front door of the ER that's having chest pain, we have 10 minutes to get an EKG, because they say time is muscle and we've got to get them to the cath lab. So our ambulance crews actually will send us one of these over, they will call the ambulance, say, I'm calling a STEMI alert, and they will send us the EKG. And we'll get a height and a weight, and hopefully before they get there, the cardiac cath lab team is there, and we have everything ready. So just last week we set and what they do is they go in there through the groin or the wrist into the artery, and they go up and they open that area of the heart with like a balloon, for lack of a better word. It's a stent, but it like goes in there and opens up like a balloon so that blood and oxygen gets to the heart. So last week we set our record from the time the patient hit the door to the time they opened up the heart and got oxygen and blood to it was 14 minutes. And that was our best time. So it is really important when somebody comes in with this, 15, 20 minutes can make a total difference in whether this guy dies or whether he lives the rest of his life with half a heart that's working and cardiac problems for the rest of the time. So those are really important things that we go fast, and you can't just sit somebody out in the lobby forever with chest pain. You have to find it. We also call trauma alerts. Anything can and will happen. You never know what's going to happen. Trauma is the same thing too. They say, you know, time is essential. You have a golden hour for somebody that's in a bad trauma. If they're losing blood and you don't get them back, you don't get blood, you don't stop the bleeding quickly, then your chances of survival are pretty bad in a bad trauma. So the ambulance will call a trauma alert, and what that does is if somebody's getting on the CAT scan table, if somebody is, you know, lab comes immediately, x-ray comes immediately to the ER, and if somebody is getting ready to go on the CAT scan table, they'll hold the CAT scanner, because the most important thing is you need to know what the injuries are so you can tell whether you need to go straight to the OR to fix it. The other big thing that happens quick that we call we're a stroke center. So we have several really good neuro doctors, and you've probably seen this out in the community, and it really is important. It's the same. So if there is an area of the brain that a clot or something has formed in, or a bleed, it's essential that you quickly stop that, and that could be the difference in, you know, somebody being bedbound for the rest of their life or having a full recovery. There are medications that you can give if you identify that it's a stroke and a certain type of stroke, and you find it within 3 hours. It's a dangerous medication, but you can give it, and it's basically called a clot buster, and it opens up that clot, and some of those people have gotten full recovery of everything. So definitely this is the same thing. If they come through the front door in triage and they have any facial droop, arm hanging down, you know, slurred speech, then we call a stroke alert. Same thing, lab comes, x-ray comes, the CAT scan table is cleared, and we get them straight to CAT scan. For all these reasons, that is the reason I guess I'm still in the ER for as long as I have. I don't know that it keeps me young. I'm definitely not bored, but I do like to have to think on my feet, have critical thinking skills. There's a lot of professionalism and teamwork, and the bonds that, like I said, you can't take care of those kind of critical patients and not get close to your coworkers and feel good when you go home when somebody came in, you know, doing CPR and you got them back, and you know that somebody has their family member to take home with them that night. And definitely, you know, you have your team's back. Will I be able to do it until I retire? I doubt it. It's a hard job. You're on your feet for 12 to 13 hours a day. Lunch breaks aren't guaranteed, and you know, often we don't take lunch. So if it's just too busy to do. But the good thing about nursing is nursing degree opens so many doors. So definitely when I decide that I don't want to live this crazy life anymore, I've got hundreds of opportunities that I can go. Medical, surgical, nephrology, you can do operating room, day surgery, surgery center, obstetrics, the cardiac cath lab, intensive care, flight nursing, discharge planning, stuff like that, where you're helping people set up home health care and you're helping them go home and live a good life as good as they can live at home. You can work in the corrections department, be a school nurse, behavioral health, dialysis, you can do teaching. There's just so much that you can do. It's endless. I mean, there's so many other types of nursing that I can't even tell you about. My brother-in-law retired, decided to get out, took an early retirement from an oil field company after being there 18 years. And he got, he went into media and stuff like that and kind of found that there was no jobs in that. And he was thinking about going into physical therapy. And I said, you should be a nurse because there's not a lot of jobs. You know, just look at the job openings. And I kind of really didn't think he would do it. And how long has he been a nurse now?
Oh, since...
Oh, no.
Oh, I don't know, 12 years?
He's a big old bearded man.
12,
big
13
old
years.
bald bearded man, and he's a great nurse.
Former Marine.
Former Marine, and he has done the corrections. I don't have nursing home on here. He's worked at nursing homes. He's done home health care. He's been a school nurse. And he is now kind of on the insurance, workman's comp side of thing. I mean, he also furthered his degree and got a degree in being like a legal expert for attorneys. I mean, there's just so much out there. I just can't even tell you. And that's definitely, like right now at San Juan Regional, there are 45 job openings right now today for nurses alone at just one hospital. That's one employer in San Juan County that they have 45 openings. I could definitely go to any city in any state and have a job next week. I could probably make 3 phone calls today and have a job. And just by talking to somebody. Pay and benefits are great for most places that hire nurses. It's definitely a good field to go into. And I didn't start, my first 3 years of college was not in the medical field. And I just think God knew what I needed to do, and He headed me the other way. Right now, ER is still where I belong, and I feel blessed to have a job that I love, that every morning I get up and I don't dread going to work. I don't moan about it. It's just, I still love my job, and I feel blessed that I still do. And you make friends for life, and most of my best friends are people that I work with or have worked with. Any questions?
What's the craziest thing that's ever happened to you in the ER?
Probably the craziest thing might not be something that I should tell you.
Is it that time that lady attacked you?
Yeah, I got tackled in the hall one time. Not just, I've been pushed and shoved a lot of times, but this was a full-on running tackle and kicking and...
Poor Tonya.
But I had 2 pregnant co-workers that saved my back. It's kind of funny.
While your legs were in the air.
They were all saying, come on, aren't you from Bloomfield? Don't you have a shank in your hair? I said, we don't do that in Bloomfield. So it was just, that's probably the craziest thing that's happened.
Well, thank you for coming in. We appreciate it and thought it was very informative.
Well, thank you. I enjoy it. Definitely. If you ever have any questions, I would be available. I mean, really a good job choice. You don't have to get in the bloody stuff to be a nurse, so there's all kinds of things you can do.
Well, thank you. So I guess that's it for today.
I guess that's it for today. Thank you.